Welcome to Logical Ayurveda. So, to be a successful Ayurveda practitioner, it is very important that we do two things. We should keep our concepts extremely silly and simple, as clear and crystal as ice water. Number two, we should under-promise and over-deliver. If we tell the patient that the particular disease will be cured in 30 days, that disease should get cured in just 15 days. Always the quality of ethical practitioner should be, he should under-promise and over-deliver. Whereas the quality of a quack or a fake practitioner is that they over-promise and under-deliver. So, to achieve this both things, today I am going to teach you my most successful combination for pithaja disorders that my guru taught me that had made wonders or massive success in clinical practice. The combination is nothing but mix of Mahatikthaka Kashaya and Saribadyasava. So, it is a single combination that can cure innumerable infinity number of pithaja disorders. It can cure pimples in the face. It can cure hyperhidrosis, that is oversweating. It can cure dry skin. It can cure burning sensation. It can cure hair fall for the patients. It can cure white discharge, and it can leukorrhea, and it can also cure urinary tract infection. So, before going into what it can cure, first let us understand where you should not give. Most of the times, the knowledge of where you should not give a certain combination is much more important than where this should be given. So, first I will teach the contraindication of where Mahatiktaka Kashaya and Saribadyasava should not be given. Number one, patient has ama. How do you know that the patient has ama? You ask him to show his tongue. The tongue is coated, and he feels tired after having food. He feels heaviness after having food. He is always bloated. In such conditions, Mahatiktaka Kashaya and Saribadyasava should not be given because it is little guru to digest. Number two, in pure kaphaja vikaras, you should never dare to touch Mahatiktaka Kashaya and Saribadyasava. Like, if the patient Vyadhi is because of the cooling nature of the disease, like sinusitis, kaphaja shirashula, and kaphaja pratishaya, kasa, shwasa, wheezing. Never touch Mahatiktaka Kashayam and Saribadyasava. And number three, it should be used with caution in rainy and cold seasons. Why I am telling you use with caution in rainy and cold season? Because even in summer season, we have the patients that comes to us with sinusitis. And even in winter season, the patient comes to us with the heat boils. So it does not matter, give according to the dosha, but when it is cold, always remember to use with caution because the combination is very cooling to the body. So, coming to pimples, we can see people spending thousands and lakhs on cosmetic treatment and laser treatment and whatnot to cure their pimples. I literally pity them. I literally feel sorry for them. I literally have feelings for them because Ayurveda can cure their pimples with a 250 rupees weekly medicine that is a combination of Mahatikthaka Kashaya and Saribadyasava. So, 80% of the pimples are pithaja pimples. How do you identify the pithaja pimple? It is red in color with a white little pustule that is trying to break out initially. There will be pain on touch. And in second stage, what happens? The pustule breaks out and the pimples later gets healed and it will turn into blackheads or depression at that particular site, that is pithaja pimples. If there is only plain red color without itching, without pain, without burning sensation, without it get popped up, it is most probably kaphaja in nature, not pithaja in nature. So pithaja pimples always have red color with the white color popping up in the middle, pain on touch, and the pustule which breaks out later changes into blackheads and have a permanent depression over the particular site. So, why always pitta, when pitta gets vitiated, people have pimples, people have seborrheic dermatitis, people have scalp psoriasis, etc. Because pitta is Agni itself. You fire a matchstick and you keep it in any direction, you turn it upwards or you turn it downwards, whichever direction you turn, Agni will be always facing upwards against gravity. So whenever in the body the Pitta is vitiated, the first thing that is getting affected is Urdhva Jatru, that is head and face. All the problems will come there. When you eat chicken or when you eat spicy food, when you eat anything, first pimples will come, seborrheic dermatitis and scalp related issues, hair fall, etc. will come. So Pitta always affects the head. Remember that. So here, once you identify that is a pithaja pimple, you give Mahatikthaka Kashayam and Saribadyasava to the patient. Patient will have result within 10 days of giving this medicine. If it is a chronic disease, then it may take some time. But if it is of recent origin, definitely that will give instant result to the patient. Again, if the patient is Agni is less, don't give Mahatikthaka Kashayam. Usually, we prefer Mahatikthaka Kashayam tablet instead of Mahatikthaka Kashayam. Mahatikthaka Kashayam tablet 2 BD before food along with the hot water, and Saribadyasam 20 to 30 ml after food with normal water. So, if the patient Agni is less, instead of prescribing Mahatikthakam for the patient, you can use Gulichadi or Vasa Gulichadi, that will correct Agni also. So, if you feel it is not perfect Pitta, so something is wrong in this fellow is having a lot of oil fried foods and cholesterol rich foods and little kapha is there in the pimple, it's not pure Pitta, then you can choose Nimbamritasava instead of Saribadyasava. So I am once again repeating it, you are feeling that the Agni of the patient is very less, he has Ama and he has all other kapha associated with it, then instead of prescribing Mahatikthaka Kashayam and Saribadyasava, you can prescribe Gulichadi Kashayam or Vasa Gulichadi Kashayam tablet along with the Nimbamritasava, because we want you to succeed in every ball that is bowled by the bowler. You need, as a batsman, you need to give a perfect shot. So as a Vaidya, we need to identify the perfect dosha in the particular patient and give treatment accordingly. And for pimples, there are innumerable thousands of patients that is available who comes to us on a regular Ayurveda practice. So curing them is of utmost importance for us. So, coming to hair fall. Here, most of the hair fall is caused by dryness. We see a lot of people lately do not have the concept of sneha at all. They don't apply any oil on head, and which ultimately leads to dryness, and they daily wash their hair with shampoos, which in turn creates much more rukshata, and ultimately it leads to much more hair fall. Okay, hair scalp is also like a paddy field where you need how for an agricultural field you need water. In a similar way, for hair to grow, there has to be some sneha which is applied to it. So this is where, because of rukshata, when hair fall is there, Mahatikthakam Kashayam and Saribadyasava comes to play. So let's decode Mahatikthakam. So Mahatikthakam, we can see so many people say it is 50% amla. So amla is rich in vitamin C, iron, calcium, and it is good for hair growth. And Sariva contains free radicals that prevent aging, etc., etc. So now this is parallel thingy. The way I want to think how Mahatikthakam Saribadyasam works is, amla, Mahatikthakam contains 50% of the amla, which is amla rasa and madhura vipaka. Amla is vata pitta hara. Amla is rasayana. Amla is kesha vardhana. Amla is rakta vridhikara. So definitely amla will help in hair fall. And another thing is, this is a very most important thing. Put your whole concentration into what I say next. Tikthakam is ASTHI vardhanam. Mahatikthakam contains 50% amla and Tikthaka. Tikthakam is ASTHI vardhana. NAKHA and KESHA are mala of ASTHI. So when hair fall is there, you improve the ASTHI dhatu, hair fall gets automatically improved. See, I always encounter so many cases of brittle nails. People consider that oligonekia, fungal infection, etc., 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 and they go on giving fungal infection medicine. Even in Ayurveda, they compare that to fungal infection and give manjishtadi, whatnot. And in allopathy, they give fluconazole and all. But the way I see it and the way that gave me success in clinical practices, I see ASTHI is weak. There is rukshata, there is kharata, and there is weakness that I can sense, and there is lack of sneha. So what I do to such patients, I ask them to take Mahatiktaka GRITHA or Guggulutiktaka GRITHA, because I want to improve the ASTHI. NAKHA is Mala of ASTHI. So when I improve certain dhatu, its Mala will also improve. So I gave, with this concept, I gave Guggulutiktaka GRITHA and Mahatiktaka GRITHA, and you know what? Their nails, they got so many. I've got so many patients of brittle nails and oligonekia after that, after giving Guggulutiktaka GRITHA and Mahatiktaka GRITHA capsule, just because I applied a proper Ayurveda physiology concept, not allopathic physiology concept. I applied proper Ayurvedic physiology concept and doshic concept, and I got a result there. Similarly, when hair fall is due to Rukshata, when hair fall is due to Ushna, Mahatikthaka Kashaya Saribadyasava can give results within a week. You can also add, if excessive pitta is there, you can also add Abhipatti Churna as well. Another one interesting application of the Mahatikthakam and Saribadyasava is its use in fistulas and Nadi Vrana, in use in anorectal diseases as well. As you know that most of the anorectal diseases happens because of two reasons. One is Pitta Vriddhi, that is Ushna Guna Vriddhi. So many people know this because it happens because of heat, and that is improper Vata and Lomana. These two causes are the most important causes for formation of the anorectal diseases like fissure, bleeding piles, fistula, pilonidal sinus, etc. In smaller Nadi Vranas, smaller pilonidal sinus, low level fistula, etc., giving Mahatikthakam, Saribadyasava and Avipatti Churna are Trivrit Lehya. We have seen two things. One, we have seen disease getting cured. Number two, we have seen the risk of pus spreading even further. I had few patients who took Mahatikthakam, Saribadyasava and Avipatti Churna, who had low level fistulas and pilonidal sinus, and it did not disturb them ever since. It's been 4 years, 5 years, etc. And I gave this combination. They took it regularly for 3 to 6 months, and they report that their fistula or pilonidal sinus, it's present, but it does not bother me. So this is something that is really commendable. This is something that is really arguable, because in the present pilonidal sinus, in the presence of Shalya, that is hair, getting result is almost difficult, and it can come back anytime. I even told them so. I even argue the point of getting result, but result is there. Definitely people accept it. If they take Mahatikthakam, Saribadyasava, Trivrit Lehya for low level fistulas and pilonidal sinus, it definitely works. That is why two things can happen. One, we can see that the disease is getting cured, but cured temporarily, but there is no guarantee that it won't come back. Okay, even for years together it may be under control. Number two, it reduces the risk of pus spreading even further. So even if they want to go for surgery or something, giving Mahatikthakam, Saribadyasava, Avipatti Churna delays the process and does not make it an acute disease, and it delays the process, etc. Especially for pilonidal sinuses, where I see that the particular disease of pilonidal sinus and some fistulas, which are getting increased in March-April time, which is an extreme heat season. So giving Mahatikthakam and Saribadyasava in that particular time really reduces the risk of getting pilonidal sinus, and if they already got it, then it reduces the risk of pus spreading even further. When so much of pus is there, then you should not choose Mahatikthakam, Saribadyasava. For the pus to break down, you have to choose Ushna Kalpanas like Guggulutiktaka, GRITHA and Kashayam. But when it is in small stage, in just starting stage, or the pus is already discharged, then you can go for Mahatikthakam, Saribadyasava and Avipatti Churnam. That will be extremely helpful in anorectal diseases. I repeat, I have so many patients who took this Mahatikthakam and Saribadyasava for fistulas and pilonidal sinus, and they till date they tell that it has not bothered them anymore without having any surgery. So coming to hyperhidrosis, there are three causes of hyperhidrosis. One is Pitta Vriddhi, that is excessive heat in the body. The other cause is stress or anxiety. You see that exam going children who is writing, they have anxiety, a lot of anxiety, they sweat in their hands, they cannot properly hold a pen, and they sweat in between their feet and chappal, and the chappals become so wet. So hyperhidrosis is also a classic textbook symptom of stress, and it also happens in obesity. It's in Staulia it is explained. Atisveda is one of the factors. So hyperhidrosis is also, you have to see these three things while treating hyperhidrosis, because if it is of excessive heat, then definitely Mahatiktaka Kashayam and Saribadyasava will give excellent result. Just imagine Mahatiktaka Kashayam giving this combination is like when the milk is fully boiled and it starts spilling out of the vessel, we go run and off the stove to stop it from spilling. Similarly, here pitta dosha is fire and the body is milk. When excessive heat is there, sweat is being spilled out. So turning the gas off is like giving Mahatiktaka Kashayam and Saribadyasava. Ask them to continue this prescription for 3 months and they will have a very good result. There are so many people who go to dermatologists for the same hyperhidrosis, and in English medicine they definitely don't have any treatment for hyperhidrosis. They have no idea how to reduce this, and people are spending so much for this without having a solution. This is where Ayurveda can come in and give a wonderful solution for the patient. Another interesting of Mahatiktaka and Saribadyasava is in the case of Visarpa. Now Visarpa is in contemporary science is correlated to two things. One is cellulitis and another one is herpes zoster. Cellulitis is a bacterial infection that keeps on spreading, and when the wound is having excessive burning sensation, pus discharge and bleeding from the wound, then definitely internally administering Mahatiktaka and Saribadyasava can give beautiful results. And we can also wash the wound with Triphala Churnam followed by application of Shatadauta GRITHA. That will give extreme good result in burning, etc. Now remember, Shatadauta GRITHA application externally should not be given when there is excessive purulent discharge, because it will block the discharge of the pus. When there is minimal discharge or when the wound is dry, then only you should try washing it with Triphala Kashaya and then applying the Shatadauta GRITHA. If not, only plain wash with the Triphala Kashaya is enough. So we have seen cellulitis healing good and fast with the help of Mahatiktaka and Saribadyasava. It can also be given in herpes zoster. In herpes zoster, especially when giving these medicines, Mahatiktaka, Saribadyasava or Gulichadi or Kamaduga Mukta, etc. So many medicines. Giving these Pittahara medicines initially from the first day, it's a main thing is, when you give Ayurvedic medicine for herpes zoster, post-herpetic neuralgia will not be there. When you give antivirals for herpes zoster, post-herpetic neuralgia will be there. Post-herpetic neuralgia is a pain or burning sensation at the particular site even after herpes is healed for 6 months or years together. So when herpes is treated with Ayurvedic drugs, not with antivirals, post-herpetic neuralgia will never be there, will not be there. You can even co-prescribe Mahatiktaka and Saribadyasava along with the antivirals. I have not seen people getting any side effect. That will also significantly reduce the risk of patient having post-herpetic neuralgia. So there are two conditions in which you should be very careful about choosing Mahatiktaka and Saribadyasava. One, if there is no Agni, then you should go for Vasa Gulichadi or Gulichadi Kashayan tablet along with Nimbamritasam, etc. Number two, if the patient has the need of GRITHA, if the treatment is going on so many times with Mahatiktaka and Saribadyasava, then probably you should shift to Mahatiktaka GRITHA, or where there is a need of a Snigdha Kalpana, then you should choose Mahatiktaka GRITHA instead of Mahatikthaka Kashayam and Saribadyasava. You can also end the treatment with Mahatiktaka GRITHA. That will give beautiful results. Thank you so much.